I bet you didn't know that 40% of Americans are walking around with a hidden circulatory time bomb in their legs right now. We're talking about chronic venous insufficiency. And if you think varicose veins are just a cosmetic issue, you're dangerously wrong. Here's the shocking truth. Every year, over 500 Americans develop painful leg ulcers because their veins simply can't do their job anymore. We're spending billions of dollars on invasive procedures, compression stockings, and pharmaceutical treatments that often fail or only provide temporary relief. The medical establishment wants you to believe that surgery is your only option, but what they're not telling you is that nature has provided some incredibly powerful solutions. Tonight, I'm revealing 5 research-backed natural herbs that can dramatically improve your vein health, and the #1 most powerful combination that actually outperformed prescription drugs in clinical trials. This isn't folk medicine or wishful thinking. These are scientifically proven compounds that major medical journals have validated, and they're available right here in the United States. But here's what makes this even more urgent. Chronic venous insufficiency doesn't just cause unsightly spider veins. It leads to blood clots, dangerous swelling, and in severe cases, life-threatening complications. Your circulatory system is literally crying out for help, and every day you wait is another day of progressive damage. Drop a leg emoji in the comments if you or someone you know struggles with varicose veins. And let me know where you're watching from. I want to see how many of us are dealing with this silent epidemic. Now, before we dive into these game-changing herbs, let me explain what's really happening inside your legs. When your venous valves become weak or damaged, blood starts pooling instead of flowing back to your heart. This creates pressure, inflammation, and eventually those twisted, bulging veins. We all recognize it. The conventional approach treats symptoms, but these natural compounds actually address the root cause by strengthening your vein walls and improving circulation. Let's count down from number 5 to reveal the most powerful natural vein supporter that clinical research has ever validated. Starting at number 5, we have Gotu kola, scientifically known as Centella asiatica. This isn't just some random herb. It's what I call the Asian collagen rebuilder. And here's why. It's absolutely revolutionary for your veins. Gotu kola works through a fascinating mechanism that most people don't understand. It contains powerful compounds called triterpenoid saponins that directly stimulate collagen synthesis in your vein walls. Think of collagen as the structural foundation that keeps your veins strong and elastic. As we age, this collagen breaks down, leading to weak, sagging veins that can't effectively pump blood back to your heart. The research behind Gotu kola is impressive. A groundbreaking study published in the Journal of Angiology followed patients with chronic venous insufficiency for 8 weeks. Participants who received 60 milligrams of triterpenic fraction of Gotu kola twice daily experienced remarkable improvements in vein health. We're talking about significant reductions in swelling, pain, fatigue, and that heavy sensation in their legs that so many people just accept as normal. But here's what makes Gotu kola truly special. It doesn't just strengthen your veins, it actually decreases the permeability of your capillary walls, which means less fluid leaks into your tissues. This is why people see such dramatic reductions in ankle swelling and leg heaviness. The recommended dosage is 20 to 60 milligrams, 3 times daily of an extract standardized to contain 40% asiaticoside. However, there are some important safety considerations Pregnant and nursing women should avoid gotu kola. And people with liver problems need to consult their doctor first. Some individuals may experience drowsiness, so be cautious when driving or operating machinery. Moving to number 4, we have butcher's broom, or Ruscus aculeatus, which I like to call the ancient vein tightener. This humble evergreen shrub has been used for over 2,000 years. But modern science has finally unlocked the secrets of why it's so effective. The magic lies in 2 primary compounds, ruscogenin and neoruscogenin. These are steroidal saponins that have a direct effect on your vein walls. According to research from American University in Washington, D.C., these compounds activate specific receptors that stimulate the release of noradrenaline, which increases vascular tone and causes your veins to contract more effectively. A landmark study published in Arzneimittelforschung followed 166 women with chronic venous insufficiency for 12 weeks. The results were extraordinary. Participants taking butcher's broom extract showed a reduction of 827 milliliters per day in fluid accumulation compared to placebo. Their leg volumes decreased by 16.5 milliliters after 8 weeks and 20.5 milliliters after 12 weeks. But what really impressed researchers was the improvement in subjective symptoms. Participants reported significant reductions in that heavy, tired feeling in their legs, decreased sensation of tension, and less tingling. The German Commission E has officially approved butcher's broom for chronic venous insufficiency, which is basically the gold standard for herbal medicine approval in Europe. The typical dosage is 150 milligrams twice daily, often combined with vitamin C and hesperidin for enhanced absorption. However, if you're taking blood pressure medications or stimulants, you need to be careful about potential interactions. At number 3, we have grape seed extract, which I call the French circulation booster. This isn't just marketing hype. Grapeseed extract is commonly prescribed by doctors in France for varicose veins and other vascular problems. And American research is finally catching up. The powerhouse compounds here are called oligomeric proanthocyanidins, or OPCs. These are incredibly potent antioxidants that have been shown in laboratory and animal studies to make blood vessels more elastic and less likely to leak fluids that cause leg swelling. A cutting-edge study used 4D flow magnetic resonance imaging to actually measure blood flow changes in patients with chronic venous insufficiency. This is space-age technology that can visualize blood movement in real time. Participants were divided into 2 groups, one receiving compression stockings alone, and another receiving stockings plus 150 milligrams of grapeseed extract twice daily. The results were remarkable. The group taking grapeseed extract showed a significant increase in blood flow velocity of 85 centimeters per second compared to the control group. This isn't just statistical noise. This represents a meaningful improvement in circulatory function that patients could actually feel. What makes grapeseed extract particularly interesting is its dual action. Not only does it strengthen vein walls, but it also has powerful anti-inflammatory properties that help reduce the chronic inflammation that contributes to vein damage. The standard dosage is 150 milligrams twice daily, but you need to be aware that it can increase bleeding risk, especially if you're taking blood thinners like warfarin or aspirin. Now, we're getting to the heavy hitters. At number 2, we have pycnogenol, which is a standardized extract from French maritime pine bark. I call this the pharmaceutical-grade plant medicine. And for good reason. Pycnogenol consists largely of oligomeric procyanidins and their monomeric catechin and epicatechin units, along with other beneficial compounds like taxipholin and phenolic acids. This complex mixture creates what researchers call a synergistic effect. The whole is greater than the sum of its parts. Here's where it gets really exciting. A prospective controlled study published in Clinical and Applied Thrombosis compared pycnogenol directly against Daflon, which is a prescription medication commonly used for chronic venous insufficiency. 86 patients with severe chronic venous insufficiency were divided into 3 groups. One received 150 milligrams of pycnogenol daily, another got 300 milligrams, and the third received 1,000 milligrams of Daflon. The results were absolutely stunning. After 8 weeks, patients taking pycnogenol experienced a 35% decrease in ankle swelling compared to only 19% for those on Daflon. Even more impressive, a composite score measuring edema, pain, restless legs, heavy swollen legs, and skin changes showed pycnogenol was 64% effective compared to Daflon's 32%. But here's what really convinced me about pycnogenol's superiority. Researchers measured tissue oxygen and carbon dioxide levels in the lower legs using specialized sensors. Pycnogenol treatment significantly increased tissue oxygen and lowered CO2, indicating substantial improvement in blood circulation. Daflon showed no significant effect on tissue oxygenation. The recommended dosage is 100 to 150 milligrams twice daily, and it's generally well tolerated with minimal side effects. What's particularly impressive is that pycnogenol has been studied for over 35 years, with more than 220 published studies ensuring its safety and efficacy. And now, the moment you've been waiting for. The #1 most clinically proven natural compound for varicose veins and chronic venous insufficiency. This is horse chestnut, scientifically known as Aesculus hippocastanum, and I call it the clinically proven champion. Horse chestnut isn't just another herbal remedy. It's been subjected to more rigorous scientific scrutiny than most prescription medications. The active compound is called acin, and its mechanism of action is incredibly well documented. Acin has powerful anti-inflammatory properties, helps constrict blood vessels, and significantly reduces capillary permeability. Here's what makes horse chestnut absolutely extraordinary. A comprehensive Cochrane review analyzed 19 different studies involving thousands of patients. This is the gold standard of medical research. When Cochrane reviews something, the entire medical community pays attention. 9 of these studies found that daily doses of 600 milligrams of horse chestnut extract containing 50 milligrams of acin, taken for up to 8 weeks, significantly reduced symptoms of chronic venous insufficiency, including leg pain, swelling, and itching. But it gets even better. One particular study found that horse chestnut extract was as effective as compression therapy at reducing swelling and leg volume. Think about that for a moment. A natural plant extract performing as well as the gold standard medical treatment for venous insufficiency. The European Medicines Agency has officially recognized horse chestnut extract for treating symptoms of discomfort and heaviness in the legs associated with chronic venous insufficiency. This isn't some fringe approval, this is mainstream medical recognition. What makes acin so effective is its ability to increase venous tone. Your vein walls contain smooth muscle, and when exposed to acin, this muscle contracts more effectively. This creates better blood flow back to your heart and reduces the pooling that causes so many problems. The standard dosage is 300 milligrams twice daily of standardized extract, which should provide about 100 milligrams of essin. However, this is absolutely critical. You must only use products that have had the toxic compound esculin removed. Raw horse chestnut seeds, bark, or leaves contain this toxin and can be dangerous or even fatal. Look for products that are specifically labeled as standardized horse chestnut seed extract with 16 to 20% essin content. This ensures you're getting a safe, effective product that matches what was used in the clinical trials. Here's what the science tells us after reviewing hundreds of studies. Horse chestnut and pycnogenol are your heavy hitters with the strongest research backing. These aren't just supplements. They're clinically validated treatments that have outperformed prescription medications in head-to-head trials. Grapeseed extract, butcher's broom, and gotu kola provide excellent support and can be used individually or in combination. Many people find that rotating between these compounds or using them together provides synergistic benefits. If you're just getting started, here's my recommendation. Begin with horse chestnut at 300 milligrams twice daily. Look for standardized extract with at least 16 to 20% essin content from a reputable manufacturer. Give it 4 to 6 weeks to see full results. Remember, you're rebuilding damaged tissue, not just masking symptoms. For enhanced results, consider adding pycnogenol at 100 to 150 milligrams twice daily. This combination addresses multiple pathways of vein health and provides comprehensive support for your circulatory system. Always consult your doctor before making any dietary or lifestyle changes, especially if you are managing a medical condition or taking blood thinners. Some of these compounds can interact with medications, particularly those affecting blood clotting. Your veins have carried you through every step of your life. Now it's time to give them the natural support they deserve. These aren't just supplements you take hoping for the best. These are research-validated compounds that can make a real difference in your quality of life. Which herb are you most excited to try? Let me know in the comments. And don't forget to share your experience. Once you start seeing results, hit that subscribe button for more science-backed natural health solutions. And I'll see you in the next video.